What if you could get the same weight loss results of Wegovy injections without needles? The FDA has officially approved the first oral GLP-1 weight loss pill, and it's already creating massive buzz across the US. Today, we're breaking down everything you need to know about the new Wegovy once-daily pill, how it works, pricing, benefits, limitations, and what this could mean for the future of obesity and heart disease treatment. Now we discuss what is the Wegovy pill. Wegovy is a semaglutide-based medication, part of a class of drugs known as GLP-1 receptor agonists. Until now, Wegovy was only available as a once-weekly injection. In December 2025, the FDA approved Wegovy's once-daily oral pill, making it the first oral GLP-1 weight loss medication approved for weight loss, a major milestone for patients who avoided treatment due to injections. The pill officially launched in U.S. markets on January 5, 2026.
Key details on the Wegovy pill. Active ingredient, semaglutide, same as the injectable version. Dosing, taken once daily on an empty stomach first thing in the morning with a small sip of water, up to 4 ounces. Wait at least 30 minutes before eating, drinking anything else, or taking other oral medications to allow proper absorption. Available strengths includes a starting dose of 1.5 milligrams with escalation to higher doses like 4 milligrams, 9 milligrams, and up to 25 milligrams, the maintenance dose. Efficacy? In clinical trials, for example, OASIS 4, it led to an average weight loss of about 14%, regardless of adherence, or up to 17% if patients stayed on treatment, comparable to the injectable Wegovy, around 15% average. Side effects? Similar to the injection, primarily gastrointestinal issues like nausea, diarrhea, and vomiting, these are usually mild to moderate. Important notes: not approved for use in children or adolescents under 18, unlike the injection for ages 12+ in some cases. Avoid if you have a history of medullary thyroid carcinoma, or MTC, multiple endocrine neoplasm syndrome type 2, or MEN syndrome type 2, or serious allergic reactions to semaglutide. It may interact with other oral medications. Absorption can be affected. Do not use with other semaglutide products or GLP-1 agonists. How effective is the Wegovy pill? One of the biggest questions: does the pill work as well as the injection? According to Novo Nordisk, clinical trials show similar weight loss results, no major compromise in effectiveness. Dave Moore stated, "There isn't much difference. Patients don't have to choose between convenience and results." This is a huge shift, especially for people who avoided injectable treatments. Benefits beyond weight loss. This isn't just about the scale. Both the pill and injection are FDA approved to reduce the risk of major cardiovascular events, including heart attack, stroke, and cardiovascular death. The FDA classifies Wegovy as a preventive heart disease medication, which is a major milestone in obesity treatment. Pricing and availability. The Wegovy pill officially launched in the U.S. on January 5, 2026, available at over 70,000 pharmacies including CVS, Costco, and GoodRx partners. Pricing: insured patients around $25 per month, uninsured or cash pay around $149 per month. Interestingly, Novo Nordisk says the pill costs about the same to manufacture as the injection, but affordability was a priority. What happens if you stop taking it? A common concern with GLP-1 medications is weight regain. Dave Moore addressed this directly. If you go off treatment, likely the weight returns. He compared it to blood pressure medications, diabetes medications. In other words, obesity is treated as a chronic condition. Long-term treatment is often necessary.
Novo Nordisk confirmed they are actively investing in research and development to explore future options that may not require lifelong use. Competition and future outlook. Currently, Wegovy pill is the only FDA-approved oral GLP-1 for weight loss. But competition is coming. Eli Lilly is reportedly close to approval of its own oral GLP-1 drug. But this could increase access, lower prices, expand treatment options globally. Conclusion. The launch of Wegovy's oral pill represents a major shift in obesity and metabolic health treatment. With comparable effectiveness, lower costs, easier administration, and added heart health benefits, this pill may bring millions of patients off the sidelines and into treatment. As research continues, the future of weight loss medicine is clearly moving beyond injections. But it's not a magic fix. Long-term lifestyle changes and medical supervision still matter. Always consult a healthcare professional to determine if it's suitable for you